right. Welcome, everybody. Thank you so much for joining us for this special Friday afternoon Zoom session. Jake Varman, Executive Director of the New Jersey Center for Student Success at the Council of County Colleges, but many of you already know that. And it's great to see so many friendly faces and names. Thanks for being with us. We had a wonderful opportunity to connect with the New Jersey Department of Health a couple of weeks ago. And I've had a couple of opportunities to talk with Dr. Taiwo about federally qualified health centers in New Jersey. Why is this critically important? She's going to explain the details, but as so many of our students may be underinsured, uninsured, and may be in need of various types of medical care, the good news here is that there are services available. And from what I've seen, it looks like in every county or very close to it for those who are uninsured, underinsured to get access to health care, which is critically important. We see that as one of the basic needs that certainly you folks work with students to help them get through, but then also
it should be on your calendar.
That may impede their progress and impact how they are doing in their academic studies and get from class to class, from semester
the reminder
to
just
semester.
came up. So.
And so with all of that, we're delighted to have Dr. Taiwo from the New Jersey Department of Health join us, and I'm going to turn it over to you, Doc. Thanks again for doing this for us.
I just muted myself, so sorry. Yeah, no problem. I'm happy to join. So yes, my name is Omolola Taiwo, Dr. Taiwo, and I'm from the Office of Primary Care and Rural Health from the New Jersey Department of Health. I have two colleagues on here with me as well, so I'll give them a chance to introduce themselves as well. Jennifer Akwamu and Damon Coslow. Yeah, okay, he's there. So yes, Jennifer and Damon, please introduce yourselves.
I'll go first, Damon, if you don't mind. Good afternoon, everyone. My name is Jennifer Okwanu. I am the epidemiologist for the Office of Primary Care and Rural Health.
Good afternoon, everyone. Pleasure to meet you all and be with you today. Damon Coslow, the manager for the Office of Primary Care and Rural Health.
Thank you, guys. Yeah, so I'm just gonna, I guess, jump into, I don't know if it makes sense to do introductions or if I should just kind of jump in straight into the presentation.
We can go around the room real quick if we'd like. I'll just start calling on people based on who's on the screen. Ariella, how about you say hello?
Hi, I'm Ariella Panic. I am the Director of Counseling and Wellness Center at County College of Morris. Nice to meet you.
Oh, awesome. You're in my area.
Oh yeah, where are you from?
I'm in Bud Lake.
Oh, yeah, very close.
Thanks, Ariella. Let's go to Kate at Ocean County College.
Yep, I'm Kate Pandolfo, Director of Counseling Center here at Ocean County College. Nice to meet you.
Kate, welcome. Let's go to Donna Vasquez.
Hi, everyone. I'm Donna Cacamanos Vasquez. I am the Director of Student Support here at Rowan College at Burlington County.
Thanks, Donna. Let's go to Stephanie Aisha Steplight Johnson. Stephanie, we can't hear you.
Sorry, can you hear me now?
Yeah, got it.
Sorry about that. As Dr. Farman said, I am Dr. Stephanie Aisha Steplight Johnson, and I'm Director of Student Development and Career Services at Essex County College.
Thanks so much for being with us. Let's go to Tina at Passaic.
Hi, everybody. My name is Tina Robato, and I'm the Student Advocacy Specialist from Passaic County Community College.
Tina, thanks for being with us. Let's go to John at RCSJ Cumberland. Hi, John. Thanks for being with us.
How's it going? Yeah, I'm the Director of Counseling and Wellness Services over at the Cumberland campus of Rowan College, South Jersey.
John, thank you. Let's go to David Clark at Hudson. David, good to see you again.
Good to see you as well. Good afternoon, everyone. My name is David Clark. I am the Associate Dean of Student Affairs and oversee the Hudson Helps Resource Center, which we just cut the ribbon in April of this year. So this is looking forward to the information here.
David, thank you. Let's go to, it's either Danya or Dania. I'm sorry, Danya or Dania.
That's good. You got it right. Hi, my name is Danya. I am the Assistant Director of the Health and Wellness and Personal Counseling at Bergen Community College.
Thanks for being with us. And McGlynn. Hello, McGlynn.
I am a counselor and student advisor at Atlantic Cape Community College in Atlantic City.
Lucy, thanks for being with us. Lisa Doherty at Hudson.
Hi, everyone. Happy Friday. I'm Lisa Doherty, the Vice President of Student Affairs and Enrollment at HCCC.
Lisa, thank you so much for being with us. Tiffany.
Hi, my name is Tiffany Douglas, and I'm one of the social workers at Union County College, Cranford campus.
Thanks, Tiffany.
Thank you.
Miriam.
Hello, everyone. My name is Miriam Salim. I am the other social worker at Union County College.
Miriam, great to see you. Thanks for being with us. Diane at RCSJ Gloucester.
Hello, everyone. I am Diane Masleen. I'm the Executive Director of Behavioral Services at Rowan College of South Jersey, Gloucester campus.
Next on my screen is Demond at Union.
Good afternoon, everyone. I'm Damon Hargrove, Vice President for Student Development here at Union County College. Good to see you all.
Good to see you. Thanks for being with us. And next is on my screen is, oh, my dear friend, Keith Kirkland at Essex.
Oh, good afternoon, everyone. Jake, great seeing you again. And all my SAG people, good to see all of you. Keith Kirkland, Dean of Student Affairs at Essex County College. Good afternoon, everyone.
Thanks for being with us, Keith. Another dear friend, Aunt Daly Eimer, Camden.
Hi, everybody. Ann Daly Eimer from Camden County College. I'm the Executive Dean of Student Affairs and Title IX Coordinator and temporary health and wellness counselor. Thank you.
And thank you. Another dear friend, Jackie Tenuto.
Hi, everyone. I'm Jackie Tenuto. I'm the Associate Dean of Students. Oh, sorry, I'm Jackie Tenuto, Associate Dean of Students.
Jackie, good to see you. Thanks for being with us.
Thank you.
Next on the screen, Laura.
Hi, everyone. Good afternoon. Laura Green, Manager of Advising at Salem Community College.
Great to see you, Laura. Thanks for being with us.
Thanks, Jake.
Next, Leah.
Hi, good afternoon. I'm Leah Travers, and I'm the coordinator of student advocacy at Passaic County Community College, and I work with Tina.
Leah, good to see you.
And
Thanks
Hilda, she's here too.
Yes, Hilda's next on my screen. Hilda.
Well, good afternoon, everyone. I'm Hilda Martinez Gutierrez, and I'm the Senior Counselor Tutor Coordinator at Passaic County Community College with our TRIO SSS program. We have 3, and I'm a part of the classic ones. The other 2 are STEM and ESL. Thank you for having me.
Hilda, thank you for being here.
Yes.
Next, Catherine.
Hi, good afternoon, everyone. My name is Catherine Morales. I am the Director of Hudson Helps Research Center at the Hudson County Community College.
Catherine, thanks for being with us.
Thanks for having me.
And next on my screen is Yannick.
Good afternoon, everyone. I'm Yannick Latson, the Director of Counseling at Mercer County Community College.
Yannick, thanks for being with us. Anyone we did not call who didn't get a chance to introduce themselves? All right, well, as you can see, we've got the pretty great statewide representation here today. A lot of interest in what we're going to hear today. So I will turn it over to you, Dr. Taiwo. Thanks for doing this for us.
No problem, and thank you guys. All right, so let me share my screen. Forgive if you see a million and one things. Let's go from there. Do you see it?
Yes, we do.
Okay, perfect. Okay. So yes, so I introduced myself, so I'll go through that. Or we can bypass that. So for the Office of Primary Care and Rural Health, our mission is really to just improve access to care and advance health equity. And so we do that through a series of different programs. Our name kind of actually derives from two HRSA grants. So these are the health, I never get this probably, health resource and something administration.
Health services and resource.
Yes, I never get it properly, I tell you, every single time. And they are our funders, so we should. So yes, our primary care office, which we've been operating for about 30 years, and we really, our goal here is just to identify and address health disparities, identify healthcare workforce issues. So if there are areas in the state that have lower level of providers, so we look at the provider to patient ratio in the county when we're talking about primary care, dental, and mental health providers. We assess all the providers that are in the state. So there's over 31,000 providers in the state. And we review them pretty much every year to see, you know, are they still in Jersey? Have they retired? Have they moved away? Just really trying to make sure that we have an accurate number of primary care providers in the state. And that helps us then identify our health professional shortage areas, our medically underserved areas, and our population, our medically underserved populations. So if there are areas where there are high levels of low income populations or homeless, that's also really helpful for us to know, because we would need to make sure that there's an adequate amount of providers in those areas to, you know, address the population. So Jennifer also works really on the rational service area. So we really try to understand kind of patterns to care, how long it takes, you know, for people to get to their where they access primary care, what regions might be underserved, what illnesses might be more prevalent in certain regions. So those are kind of the things that we can assess through our office. All of this data really then enables us to understand, and this is kind of where the conversation I think happened a couple of weeks ago, of really trying to ensure that we're advertising a lot of the incentive programs that are federally as well as state resources. So the National Health Service Corps, that is a federal program that really helps ensure that providers can want to essentially work in underserved areas, so areas are geographically underserved, or as I'd mentioned, areas where there's a high need. There's also the state loan repayment program, which our office looks at, and the J-1 visa program, which works with foreign nationals who wish to work in the States and have maybe trained here, but would normally need to go back to their home country. So they're able to apply for the J-1 visa program and work in an underserved area. So those are kind of the things that we end up doing through our primary care office. Through our State Office of Rural Health, which is the second part of our name and also our second HRSA grant. Our goal is really to collect and disseminate information to make sure that our rural health stakeholders really understand, the funding opportunities, new research that's come out, any policies that might be pertinent for them, identify issues similar to the primary care office, collaborate with stakeholders and really try to coordinate activities. And so we try to do that through our Rural Health Advisory Council, which we're revamping now. It's a way for stakeholders to come together and really start talking about some of the issues that are unique to rural New Jersey. We are a densely populated state, but there are still issues that we have. Workforce development. So similar to the primary care office, we work with a site called the National Rural Recruitment and Retention Network, or 3RNet. And that is a way for people to go on if they are looking for work in New Jersey, particularly in the rural or underserved areas of New Jersey. They're able to go onto that site and look for what's available. And so we are working also to kind of revamp that program, just so that it's easier for people to see where there is a need in Jersey and hopefully attract more workforce, because we definitely need it. So for Jersey, we have what we consider 7 counties. There are state definitions of rural, and then there are federal definitions. And so we operate on the state one through our office. Oops, sorry. And so Atlantic, Cape May, Cumberland, Huntington, Salem, Sussex, and Warren are our 7 counties, but then there's also sub-counties. And so as we, as we're well aware, Burlington, Gloucester, Monmouth, Morris, and Ocean have some rural areas as well. And so we do focus on those regions as well. And then our new programs, we have vaccine equity programs. So through the American Rescue Plan Act, we were grateful and happy to get a few grants that enables us to work with health centers, including our federally qualified health centers, to help improve vaccine equity and ensure that every person in New Jersey, particularly our vulnerable populations, have access to vaccines as well as testing. And so right now, we have 13 grantees and we're expanding that program. So that's just kind of the overview of what of the other programs, but what actually leads us to a lot of the work that we do with our FQHCs are actually through our uncompensated care fund. So this fund was created about 30 years ago. It's a state fund, and it really enables the state to ensure that all underinsured and uninsured individuals who need to access care can access care. So hospitals get charity care and we get the uncompensated care through the FQHCs. And so we help to reimburse federally qualified health centers so that they can provide care. Through the uncompensated care, we reimburse for primary care, dental care, mental health care, which was recently added, and then telehealth, which was also recently added due to the pandemic. 23 of the FQHCs in the state participate in this program. And essentially for populations that are 250% or below the federal poverty line, uninsured and underinsured, as I mentioned, undocumented residents also happen to utilize this program quite a bit. And then just any NJ resident. And this also includes migrant workers. So if you're in the state for, just a couple of months or even a couple of weeks, they still have the capacity to access these services. Particularly, there are migrant designated FQHCs, and we can get into that a little bit later. So as I mentioned, there are 23 FQHCs in the state, and that equates to 135 sites. So the FQHCs have multiple sites throughout the state. They serve, over nearly 600,000 people in the state. And a large part of the population are Medicaid patients as well as populations that are uninsured. So just to kind of go into a little bit more details, as you can see, New Jersey, we're doing pretty well, right, when it comes to poverty level. So the 9% poverty level in New Jersey, but our FQHCs really see 71% of that population. So a large percentage of the population that FQHCs are low income. And as I mentioned, similar to uninsured rates, there's a large racial and ethnic minorities. So they do focus heavily on populations that are needed and populations that are probably mirror the students in your classrooms. So these centers, they provide a wide array of care. So I talked to you about what our office does, but outside of our office, through Medicaid and other state and federal programs, the federally qualified health centers have the capacity to do immunizations, women's health, substance use disorder treatment, cancer screenings, tobacco screening, and cessation programs, social services, mental health, as Brian mentioned as well, and other social services. And so there's a wide array of preventative medicine and care that our federally qualified health centers provide, and we're encouraged, as many people and students to utilize these services. So just to kind of get into where the locations are, the FQHCs are found throughout the entire state. And because they have multiple locations, they often focus on multiple different counties as well. So this just kind of gives you a visual understanding of where they are, but we can go to the next slide, which really helps identify which ones are in your county specifically. So there's a few in Hudson. I know we have a couple of Hudson folks on here, Alliance, Metropolitan. I feel like I'm missing one or two more. North Hudson is another Hudson one when we're talking about Southern Jersey, we have Atlantic Care, Cam Care, ChemEd, which is in Ocean, Complete Care, which covers Cape May, Cumberland, and Gloucester. Southern Jersey also, Southern Jersey Families Medical Center also covers Gloucester, so they tend to share that county. And there are also, as you can see, lots of federally qualified health centers that kind of share different counties. It just really depends on the location that they're at. And so, yeah, there really is access to these services and, regardless of what county that you reside in. And I just wanted to kind of make sure that we can see that physically. So if you guys had any questions, I'll be happy to share these slides with you as well, just so that you know which ones are in your county. So I also did want to kind of go over the Title X programs. So not all of our FQHCs, while most of them do, not all have these programs. So these programs are specifically designed to ensure that that people have access to affordable birth control and preventative reproductive health care. And so just to I'll go through some of the locations for those centers as well. We have, as I said, a better relationship with the federally qualified health centers, but I wanted to give you the locations for the other centers as well. So as you can see on here for, Passaic and I think Bergen County, North Hudson, which is a federally qualified health center, they do provide Title X care. Horizon Alliance, so they also provide Title X care, so that is also another FQHC, Atlantic Care. In Cape May, though, it's the Cape May County Department of Health and Family Planning that provides the Title X care. So Complete Care, which is the FQHC in that area, they would be able to provide a wide array of other services, particularly for those who might be uninsured. But if somebody is uninsured, they would most likely want to go to Cape May County Department for reproductive care. Further in South Jersey, FamCare, so they provide Title X care. So this area would also probably be work in the same space as Complete Care. So this is another area that people can utilize if they're looking for reproductive care. Henry J. Austin, which is in Mercer County, they are an FQHC, and then Hoboken Family would be a Hudson County program that people can utilize, and they have a couple of sites as well. As I mentioned, North Hudson, they have quite a bit of sites, and quite a bit of their sites also provide Title X care. And so this spans, I think, Bergen County, Hudson County, and I want to say is Garfield, yeah, Passaic. Ocean Health Initiative is another FQHC. So these are just kind of resources for students to be able to utilize. And then Zufall, which covers quite a bit of the North Jersey region. They have a few offices throughout North Jersey, and so they also provide Title X care for students who are looking for reproductive health. So yeah, that was essentially just a really brief overview of the different programs, but I wanted to just kind of highlight some of that, and I'll go back to the chart of which areas are in which counties, and kind of open this up for questions or discussions, or if anybody has is trying to get a little bit more details. My spiel is done.
This
Sorry
is
if there are any
terrific.
questions, yeah.
Thank you so much. This is terrific. And I really appreciate that you included locations of which FQHCs are in which counties. Guess my question's a bit of a deeper dive, and that is, with all of the services that are available to, we'll say, our students who may be in need, is there any guidance you would offer to those of us on the line? So for example, let's say we have a student who we think could get their eyes examined, right? Let's say that in a particular county. Is there something online that tells us which of these providers provide which services, or is it simply we should reach out to the provider in our county and see what's available?
So most of their websites actually have the capacity to, look at the services that they provide, and also some of them do have the capacity to do either a phone number or online appointments, or to be able to access appointments online. What we can do, I think, just to kind of help bridge that gap a little bit is if there's a contact, if we can get the contact list for all of the county colleges that are interested in partnering with their local FQHC, we can always send an email to the FQHCs and letting them know that, these community colleges are in your area and they would love to develop a stronger, partnership so that students can access the services on a more regular basis and maybe build on that partnership going forward. So it could be Dean of Student Services, whoever's that point of contact.
That's terrific. And what I'll do, I'll include that in the follow-up that I send out to everyone with your PowerPoint slides that you shared to ask to provide a contact if they're interested in working with you in this partnership, and then we can get that to you. That's terrific. Thank you.
No worries.
Any other questions, comments, folks, across the state? It's a lot in a short period of time.
Sorry, kind of rushed.
No.
Ran
But the point is, I don't know how many of us were aware of FQHCs that were available for our students, particularly for our students who may be in need of the vast array of healthcare services that you went over. Questions or comments, folks?
So this is Damon Coswell. I'm from the state, so I'm going to make a comment to give your team an opportunity to think of their questions or comments. But I want to highlight a couple of things. Number one, we can absolutely forward you a link to our website, which you can click into and actually see the list of all of the sites with their addresses. Obviously, what's on screen right now is very, very helpful from a county perspective, but drilling down into the county to see the physical address might be even more helpful, because I think some of your colleges are going to be very close to where these FQHCs are, and you might not even know that they're an FQHC because nobody, they typically don't have that in their name, or that's not on the sign, right? So it's important to just sort of know them by the names that they go by. And the FQHC, by definition is to help and serve vulnerable populations, but that does not end there. They service everyone, regardless of their ability to pay. So your students with insurance, as well as your students without insurance, they will service them. They will, link them to what they need. Whether it's in-house or if it's a particular specialty that they need to outsource to, they'll help them that way as well. And I guess I also want to take this opportunity to highlight the ability for us to collaborate with all of you and come onto your campuses and vaccinate your students. There is a big push for there's a statewide campaign for this coming Wednesday, which marks the 1-year day of when we initiated vaccines in New Jersey. So we are looking to put a big push for boosters. But with that being said, first dose or second dose would be perfect too. We ultimately just want to vaccinate folks. Certainly can't guarantee we can get a team on your site by Wednesday, but whether it's this Wednesday, next Wednesday, or any day of the week, we are more than happy to have that conversation and get you connected to a provider, whether it's one of our contracted teams, our own staff, or just an outside provider, whether it's an FQHC or other provider. We're happy to do that, and we think that might be very helpful for, and that's staff, not just students, but, and the public, whoever, however you can market it, we're happy to coordinate with you.
Thank you for that, Damon.
That's terrific, Damon. Thank you. Yes, we'll share the web link out. I'll send a follow-up to everyone on the line here. We'll share the web link out with more information, as you mentioned, and with the information you just shared about vaccinations. That's terrific. Thank you. Any other questions, folks? While we're thinking you may not be able to contribute, I got a message he's on the line, but I just want to say a special thank you to Assistant Commissioner Hornsby for being on the line with us and help opening these doors to create this workshop for us today. and for the conversations you've had with us to help advance all of this. So thank you, Assistant Commissioner, for being with us and your leadership in all of this.
I have a question if it's okay.
Sure.
Do the FQHCs, are they able to also help the patients or our students in this case apply for insurance or like linkage to insurance? I know some of our community partners, when we send a student to them who's uninsured, they help the student become insured. So that's something I was wondering if they had the capacity to do that.
Most health centers, but most of the FQHCs do have, I guess we'd call them like patient eligibility coordinators. And so they help to see which services patients can access. Like our uncompensated care is really a payer of last resort. So once they've recognized that there's no other state or federal program that the patient would be able to access, then they would be able to tap into that fund. So yeah, most of the FQHCs do have that. I don't want to say all, but I do think most of them do.
Thank you so much.
I just want to expand on that a little bit and I guess clarify that the support for insurance purposes would really be limited to Medicaid. You know, like a Blue Cross Blue Shield, they're not going to help them coordinate that. That would be unlikely. But if they would qualify or potentially qualify for a Medicaid type, they will absolutely support them with that. That's actually a requirement for them to coordinate that. For our agency could reimburse them, they need to go through that process first.
Yeah, not the exchange, like the health
Correct.
exchange. Yeah.
Right.
Leah, great question. Any other questions, folks?
I have one for the FQHCs. Are there any opportunities for them to actually come onto our campuses if we have space available for once a week, once a month, or once every other week?
Yeah, so I think that's essentially where that connection of once you guys get each other's contact information, because I think those are the areas where collaborations would be really meaningful. They do outreach quite a bit with different populations, and I think this would be a really useful population for them to tap into. So yeah, I think our goal really here is to just make sure we're connecting the dots and making sure that both you as well as the FQHCs are aware that you guys are in each other's backyards and could do a lot more work together.
And David, I'm not clear if you were looking for like primary care or dental services when they come on site, or just education and outreach, but whichever direction you were meaning in your question, they could potentially do all of that. Not every FQHC has a mobile unit, but several of them do. So several of them do take their mobile medical unit and go around, the different municipalities in the counties that they operate in and actually provide service. Some of them just have outreach teams that go out and help provide education and link them to, necessary services and whatever might be needed from there. So again, it's really dependent on, which county, which FQHC, and what the real need or expectation is. But I think that's really the goal of this conversation, is to ultimately connect you and your colleagues to the most convenient or closest FQHC, and then you guys partner. And they all have an outreach coordinator, which may or may not have that title, but that would be their function. And you discuss how to work together.
Excellent. Thank you.
Could I ask a question also, I guess? I know you had mentioned that you're working now with mental health trying to do the mental health or mental first aid, which I think is a great program. Are there other additional, I guess, issues that end up being really prevalent among the student? I know this is across the state, so it's a very loaded question really, but just kind of some prevalent issues that also tend to pop up that might be helpful for us to know as well.
Anyone want to take a first crack at that before I give a very broad statewide overview?
I'll take a crack at it. Hi,
Thanks,
everyone. Doreen from Hudson County Community College. One of the things that a lot of the students struggle with is accessibility to getting medication and getting ongoing mental health support. My team does provide short-term goal-oriented support when a student needs more clinical support, medication. That tends to be an area that we struggle with. We do have a relationship with Bridgeway Crisis, but that is a short-term program that provides maybe 5 sessions at most with a psychiatrist, and ultimately they are back out looking for, medication and other options to support their mental health and well-being. So I guess we need more collaborative relationships with other mental health service agencies that would be able to best support our students, whether it's, on an ongoing basis or a short-term basis, but in each of the different areas, especially for students that live in Bayonne versus students who live in, Jersey City, Hoboken, different areas. The other issue is I think right now, some agencies that I had been working with in the past due to the pandemic have went back to the old school thought of, we're going to only service this area of New Jersey. So for example, Vantage Health was a place where I was referring students for mental health as well as psychiatric medication. And now they are only working within their zone of Bergen County, no longer servicing Hudson County students. So it was kind of like a letdown.
Okay. Taking some notes.
So Doreen, it's, every time I hear Bayonne, I feel like my ears pop up because that's where I was born and bred and, spent my formative years getting in trouble. But I moved on since then. But so I always have an affinity to Hudson County because of that. So just sort of a comment. Almost all of the FQHCs have some sort of mental health program where they provide counseling. Now, we actually, through our uncompensated care fund for numerous years, that was never a reimbursable service. We initiated that as a reimbursable service January 2021 because we recognized the critical need for that, and that, really, although it's it's not considered primary care, but it is. It's just as important. So by us doing that, it provided additional revenue to those health centers to provide those services, to allow them to expand their part-time people, 2 days a week to 3 days a week, or maybe become full-time. So the goal was to help expand their services. Now, we do not provide reimbursement for psychiatric reimbursement, but that doesn't mean that the FQHCs do not have a psychiatrist on site, or they have a collaborative approach where their primary care physician could work with the mental health clinician and coordinate the script if needed. And that process is really specific to the different FQHCs, which they would have to dictate and share with you, because we certainly don't know that level of detail. But I just wanted to highlight that it exists. May or may not be for the folks in Hudson County, but definitely some of them.
A primary care physician would be able to collaborate with psychiatric medications and prescribe, because that's kind of unique. I rarely find medical doctors willing to even get involved with psychiatric medication.
I
Are
think
you
there's a
saying-
big difference. Yeah, I think there's a big difference between, Xanax for some anxiety, right, versus, some other,
Antipsychotic.
schizophrenia type. Yeah, yeah. So I think there's definitely a fine line between what they can and should do versus when they know they need to refer out to the specialist. But yeah, I mean, that's for them to guide, and they would, if they don't have an appropriate physician, meaning a psychiatrist on staff, they'll look to refer and to someone local that they're connected with and partnered with to make that link, because the goal is to either provide the direct service or refer out so they walk away with a plan.
Okay. Very good, thank you.
And in Hudson County, there's multiple FQHCs.
Yeah.
Alliance, Metropolitan, North Hudson.
I had mentioned, this is Stephanie Aisha Steplight Johnson from Essex County College, and I had mentioned at a prior meeting to Dr. Farbman that we did work with the Newark Department of Health and Community Wellness pre-pandemic. So we're really in a position now to reestablish that. So we've gone and met with them. Our allied health programs have met with them because those students needed exams for their clinicals. And they've also come and tabled at our college to provide information. And they've also brought out their mobile health unit. And I was just looking at one of the data sheets they provided for me. So they had come, let's say this was January 17th, 2019. So they had 16 people visit the mobile van, and they did rapid HIV testing, hypertension screenings. They did blood glucose screenings, and also provided information. So they actually have a grid where they keep track of the services that they are providing.
That's really great. Yeah. So yeah, I think it would be great to see if we can kind of scale that up and have this happening at all of the community colleges in one day. I think that's the hope here. That is really great. Any other primary concerns?
Assistant Commissioner, I see you're able to join us. If you'd like to chime in for a moment, now that you're able to join us via video and voice.
Yes, and I am so sorry. I'm at the Building a Culture of Health Conference in Atlantic City, which is a collaboration with Department of Health, the Y Alliance, and a number of other partners, the foundation realm, as well as providers. At any rate, I wanted to thank you for pulling together this discussion, this follow-up discussion to what we had talked about, and envisioned that we would have an opportunity to be able to think about ways that we can incorporate access to high quality healthcare for those who are basically in a commuter situation when it comes to college, when it comes to the county colleges. I'm a product of community college. I attended Morehouse College for my 4-year degree, but before that I was a student at Brookdale Community in Monmouth County. I'm very proud of my experience at Brookdale. It set the foundation for me. I earned a political science degree at Brookdale. And while there, I was fortunate enough to work at Jersey Shore Medical Center as my employer, and provided me with health insurance. But later on in my college experience, and specifically in grad school, when I was in law school in Newark, I had no insurance. And so I had to work with, at that time, the Charity Care Program in order to access care. And as a student, a young adult, I knew that it was important to me to have some form of coverage for care, and not to just assume that my youth meant that I wouldn't need to interact or intersect with the health system. And so what we're trying to do here is to really make sure that students aren't caught up in that situation where they have no clue as to where to go, what to do, and what types of services they have access to. I'm grateful that my staff have been able to describe for you the great work that the FQHCs do, the buckets that they provide services in, physical health, dental, behavioral health. All of that is important to overall health for people. And the students are no different than the general population in that regard. And so finally, the final thought that I will add is that as I was at Brookdale, I knew very clearly that the age of the students at the county colleges was a little older than, on average, than the students in undergrad institutions across the state. And so many of my classmates, they had children of their own. Many of them had chronic conditions that they were dealing with. There's certainly an issue around smoking. I'm glad to say that Brookdale was the first community college in the state to go completely tobacco-free under my division, which runs the tobacco program. But I'm straying a little off topic. Let me just say this. Thank you for this opportunity to be able to talk with one another. I hope that this discussion has spurred even more thought around how we can collaborate. And we want to assure you that the collaboration will ensure better health for the county college students, but it will also ensure that the students have a high quality health home. Many of them will probably stay with those homes, those medical homes, even after they graduate college. And so with that, I'll turn it back over to you all. And again, I apologize for any background noise. And I look forward to the collaboration as we move forward.
Well, Assistant Commissioner Hornsby, thank you so much for joining us, number one, when you're double, triple booked as you are. And as I said earlier, for your leadership in all of this. And we really appreciate the opportunity of connecting with you and your team and sharing all of this information and working with all of you going forward to do exactly as you just described, ensure that community college students have access to high quality healthcare, not just while they're students, but for the entirety of their lives. Thank you so much. Any other questions, folks, for our guests from the Department of Health? If not, follow-ups, I'll send out these slides. I'll also send out the link that Damon shared with us. I'll also ask all of you, if you're interested in partnering with us in this effort to better connect your community colleges to an FQHC, to send us the name and contact information of someone that we could then share with Dr. Taiwo, and then we will go from there. And I'll send all that follow-up out this afternoon.
That would be great. Yeah, and I look forward to our continued collaboration. I think there's a lot of work that can be done between the health centers and the federally qualified health centers. The community colleges and federally qualified health centers. And I think even through our office, understanding, particularly with the mental health, as I had mentioned, through our primary care office, one of the things we do look at is access patterns. And so I think it's always helpful to get an understanding of how, the difficulties that might be in place with accessing mental health. So, often we look at these areas and we're like, oh, they're densely populated. But, if you have to take 2 or 3 trains to get to another place and that takes 2 hours, that's sometimes information that we don't often see just on paper. So I think also that type of feedback is really helpful for us to understand that those accessing issues.
Absolutely. Any other questions or anything for the good of the order, folks? Well, Assistant Commissioner Damon, Jennifer, Lola, thank you so much for doing this for us. We look forward to working with you going forward in all of this. And we cannot thank you enough for inviting us to be a part of this. We really appreciate it. And for all of our community college friends on the line, thanks for being with us today. Have a great weekend. You'll get a follow-up email from me later this afternoon. So thank you all so much.
Nice
It's
to meet you all.
greatly appreciated. Thank you so much.
Bye.
You're welcome. Thank you.
Be well, everybody.
Bye-bye.
Bye-bye.
Bye all.